Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hey everyone, welcome back to Research Perch. I'm Michael Reynolds, the chair of the marketing committee for the Massage Therapy Foundation, and we are so glad you're here. I'm here as always with Nikki Monk and Ruth Warner. Ruth, how are you?
I'm great. How are you, Michael?
Excellent. And Nikki, you're joining us from your office in Indianapolis. How are you?
I'm doing great, thanks.
Awesome. Glad to have you both. As you know, if you're watching and listening, which you are because you're hearing me right now, Research Perch is designed to unpack and dig into, Ruth's laughing at me right now, thank you, digging in and unpacking articles from the IJTMB website, which is ijtmb.org, which is, of course, the International Journal of Therapeutic Massage and Bodywork. So a lot of great information on that site. We recommend you go subscribe right away. After listening to this podcast, of course, and there's a lot of good information about research and how it can help you in your practice. So what we're doing here today, as always, is kind of taking some of the specifics from these articles, digging into it a bit, unpacking it, talking about it in plain English so it benefits you, and putting it in a format that you can take with you on your mobile device or on the web. So today's topic for discussion is massage therapy for Lyme disease symptoms, a prospective case study. This one's a short one. I'm looking at the abstract, and it's actually a pretty short one, so I think we'll probably have a pretty direct kind of plain conversation here about it, because it's basically studying the effects of massage therapy on patients with Lyme disease, correct?
A patient with Lyme disease.
A patient, so a single patient. Okay, so tell us how this was set up. Well, who'd like to start off?
Well, first I'd like to make a quick point out here. You've got two authors on this particular case report, and you've got one that is a therapist practitioner, and she's actually a first author on this, so this is the woman who was actually providing the massage therapy and devising the treatment plan. But then you also have her working with and collaborating with Christopher Moyer, who is a professor and is a researcher and was helping to guide her design of the study. It was a prospective. So I like to call it purposive as well. So just very purposeful in their design, but a prospective case study. So or report, meaning that they established what they wanted to measure, and they went out and actually either had somebody identified or knew of somebody that thought massage might be beneficial for them, and actually recruited them to come and participate in this look at massage therapy effects for these pieces. So just a really nice example of a therapist-academic partnership that worked out really nicely.
Okay, so it looks like, if I'm reading this correctly, it was someone who was recruited for this particular study across 65 days, and it was measured in terms of treatment being, or massage therapy being applied, periods of treatment and non-treatment across those 65 days. So it alternated whether it was applied or not. Is that correct?
Right, and that's, I'd like to speak to this a little bit because it has some, this paper has some really significant differences between what this authored team did and what we see in a typical case report. This was a submission to the Massage Therapy Foundation Case Report Contest, and it was a winner. And I don't remember whether it was a gold, the top winner, but I know it was a winner in the year it was done. And it was a submission in the Practitioner Case Report Contest. This therapist had already graduated from massage school, but was in graduate school working for her, I think, her master's in psychology when she took on this project with Dr. Moyer. And she did something she did a couple of things we don't usually see in typical case reports. And so while it made a great project and a nice demonstration about massage in the context of Lyme disease, it's something that many of our listeners probably are not in a position to do. And so I want to delineate some of those differences. And so one of the things that this scientist did, that this researcher did, Megan Thomason, is she got approval from an internal review board because she was associated with a university. And that means her project and its description was overseen by a group of people, and Nikki can probably speak to this better than I can, but a group of people who are being sure that anything any possible ethical consideration in the context of experimenting with humans was addressed. And we don't require IRB approval for case reports when they are simply a report of what happens in client sessions, right? Because they're not actually doing an experiment. But because this one took a little different format, and she, from the beginning had the intention of a period of time where the client got massage, a period of time when the client did not get massage, and then got massage again, to compare those measures, that makes that a quasi-experiment.
So it wasn't just an observation, it was actually set up with a structure, and that's what makes it different.
Exactly right, exactly right. And that's not something that we look for in a typical case report. And if someone is thinking to do that, I really, really encourage them to do what this author did, which was to get affiliated with a university and get an IRB approval.
Okay, that's great advice, because obviously we do encourage massage therapists who are our listeners to look into doing case reports, and it's good to kind of know that line of where the ethical boundaries are to be very careful, so I appreciate that.
The huge difference between doing an experiment and observing what happens over the course of treatment as usual. And Nikki, I'd love your perspective on that.
Yeah, well, I think that there's actually some instances in practice when something like this could be done, because you have people who come in who may have, however they may have done it, tracked what their symptoms have been for a while. And so in that sort of a situation, you would have, so this particular study was broken down into 5 phases. They did measurements for a period of time before any treatment was applied, then they applied the treatment for a period of time. Yeah. Then they did a withdrawal portion, so they measured her again at the same intensity during the time she wasn't receiving any of the treatments, then did another series of treatments, and then did another withdrawal session when they were measuring again what those changes, what occurred during that measurement time point. And so if you have somebody in practice who may not come routinely, so they may come perhaps only when symptoms get really, really bad. And so this would be an opportunity or an example of when this kind of design, if you will, could be applied in regular practice and still be an observation type thing where an IRB approval wouldn't necessarily be expected or required.
Right.
So I think that, but to have something that is so prospectively designed this way, I don't think.
Set it up on purpose.
Right, and that's the piece, is that, and they even, Megan and Dr. Moyer actually addressed that in the paper. They say, in instances when it's not unethical to withdraw treatment.
Right.
And this is something that's perfectly fine, because you wouldn't want somebody who they were coming, this was part of their treatment plan, and then you say, oh, that's it. We're gonna see what happens when you don't get the sessions. You wouldn't do that with a drug or something like that. But when it's, in our field, there's a lot of times when people aren't able to continue coming, and there is opportunity when they've chosen not to come or for whatever reason can't come. They could still be gathering that information, or when they come in to the massage therapist, they could still be collected. So how was it over the past month when I haven't seen you? How was your pain level on average? And those are the kinds of measures that you could get in usual care.
That's a really, really great point. And what that reminds me of is how important it is for massage therapists to take really great notes on their progress.
Yes.
And I think that's something that isn't emphasized enough for a lot of folks, that they miss out on great opportunities to watch, to track progress if they're not extremely conscientious about note-taking. And, while this Lyme disease one, and we should probably talk about the results at some point.
Yes.
But the Lyme disease report is a nice example of what could happen if people really want to demonstrate the difference between what happens when you get massage on a regular basis and when you don't get massage on a regular basis. And now we happen to be recording this at the end of August, and people are drifting back in from their vacations, and sometimes hobbling back in from their vacations. And if, as massage therapists, we have a really nice set of notes or the diagrams where people show where their pain is that change over time. It's a really important tool to help educate our clients about what happens when they miss.
Absolutely, absolutely. And so what they established with their measurements is they actually had the young woman keep a diary, a daily diary. And so she actually did visual analog scales for pain and concentration and fatigue, which were her 3 identified main Lyme disease issues. Yeah, so those were the things that she really wanted to look at. Now they did some other measurements as well. They did some personal and positive and negative affect, and they plot that as well. But what they're able to do with this is because they're getting so many points of data, is they're actually able to do some really nice graphs, which of course I love, and we've talked about this in a previous research Perch, that it's the first thing I go to is I go and look at the figures, I go and look at the tables, and that's going to give me a really nice story of what's happening. And with case reports, you really don't have the opportunity to show data in this way, and this partnership does a really nice job of taking what is typically not very powerful data. An N of 1, a one-person study is, there's not a whole lot you can do with that outside of descriptive pieces, and they do some inferential statistics on that, but they do give the caveat, it's not very powerful, but it is something that can give some really informative pieces. So they had a lot of fun, and I really liked that piece of it. So the diagrams of it are great.
well, let's indeed talk about the outcome. Looks like it was the word they used here in the conclusion is promising, which I see a lot in articles like this, because obviously we can't make claims that are too overstated or anything, but it looks like there was a promising outcome, correct?
Mm-hmm. There was. And hey, Ruth, why don't you talk a little bit about Lyme disease?
Sure.
And where the subject was in her progression of the disease.
Well, I can talk a little bit about Lyme disease, and the author did a nice job of capturing a sort of a snapshot of what this condition is. So our listeners might be familiar with this. Lyme disease is a bacterial infection that is usually spread through the bite of certain species of ticks. And the name of the bacteria, it's got a beautiful name named for the scientist who discovered it. It's called Borrelia burgdorferi. And what happens is when a person is bitten by the species of tick that carries this, and they're usually some species of deer tick, although it's been identified that the bacteria are usually picked up from mice. In any case, so a person's bitten by a deer tick that feeds for a couple of days. These are slow feeders, but the ticks are teeny tiny, so you might not notice. And at some point, there's a saliva exchange, and so the bacteria that live in the midgut of the cootie, it's a technical term, cootie. The bacteria that live in the midgut of the tick end up being sort of regurgitated into the bloodstream of the host, and that's what leads to, and then the bacteria take up residence very often in joint spaces, and that's why in my pathology book and in a lot of other resources, Lyme disease is often discussed as a musculoskeletal disorder. And interestingly, the history of Lyme disease, it's named for a town in Connecticut. It's named for Lyme, Connecticut, where Dr. Burgdorferi was hired to figure out why there was this sudden spike in diagnoses of juvenile rheumatoid arthritis, which is, not a terrifically common condition and not considered to be contagious. And so to have a population spike of this condition was really weird. And it turned out that it wasn't rheumatoid arthritis. It was this arthritis brought about by this bacterial infection spread through the bite of deer ticks. So as a bacterial infection, it's treated with antibiotics, but because it gets into the joint spaces and can also get into the central nervous system, and it can be very, very hard to get at. So it can take weeks or months of this antibiotic therapy. And in fact, there's a lot of controversy about when the antibiotics don't work, whether it really is Lyme disease or whether it's something different. There are other tick-borne diseases that can be spread by similar species. So this patient, this person, a 21-year-old woman with Lyme disease, whose main complaints were pain, fatigue, and problems with concentration, could look like a 21-year-old with fibromyalgia or with chronic fatigue syndrome. And these are conditions that are frequently overdiagnosed, comorbid with Lyme disease. And it takes time and effort and a lot of money sometimes to distinguish which is which. One of the things I really liked about this paper is the author looked for any research done about massage therapy and Lyme disease and found virtually none. So then she thought, well, what's like Lyme disease? What presents really similarly to it that there might be some evidence on? And she went to rheumatoid arthritis, which was perfect. As we've seen, it's often, in its earliest discovery time, it was misdiagnosed as a type of rheumatoid arthritis. The effects on the joints is very similar. And so it was a reasonable, what do we call it, when you sort of stretch one finding to apply to another.
You extrapolate it.
A reasonable extrapolation to say, well, all right, if massage therapy has some evidence in the context of rheumatoid arthritis, I think it seems reasonable to test it in the context of Lyme disease.
Very nice.
That's
right.
a little thumbnail sketch.
Thank you. Yeah, and so that's how they developed the treatment plan, and they started off with they actually worked with light to medium pressure the whole time they were doing the treatments. And one of the other interesting things that they report is that the participant did experience some discomfort after the treatment sessions to begin with. It didn't last very long, but that then she would feel better for longer periods of time afterward. And I think what's really nice is that now you have something like this in the literature. Now, granted, it's just one person's experience, but a massage therapist could point to this and to be able to say, okay, well, this is something that has happened with other folks. They did have some discomfort. Shouldn't last too terribly long. They didn't have that, but it gives a little bit of information for them for their practice. So somebody comes and says, gosh, I was feeling a little poorly afterwards or having some discomfort.
Yeah.
Right, it's like, okay, this has been documented before.
Well, and the other thing that they found, and this is something that is actually visible in the charts, I have to admit, even I got this, is that the positive outcomes from the sessions were greater later in the series. In other words,
yes.
It was like this client learned how to receive massage. Yes. And we've all, those of us who have been in practice, we've seen that happen, right? That receiving massage is a learned skill. The more you get, the better you get at receiving it. And we have here, a documented case of someone who felt better results from her massage therapy as she got better at receiving it. And that's another nice piece of education for clients.
Yes. I think there's also a piece here, too, and as I'm looking at this chart that they have in their figure 1, it shows, and one of the main outcomes that they talk about is the fact that there is an increase in the symptoms. So basically what they did was they had the 3 different VAS, visual analog scales, and because they all correlated really nicely together, in other words, when they did a particular statistical test, when one was high, the other one was high really consistently. And so they decided, because they had this strong correlation together, it was reasonable for them to lump it all together and have one score for these 3 pieces, and that's the piece that they were charting, okay? And so when you take all of the different points and the different phases together, in the ones where there wasn't massage happening, there was an increase in that overall score across the course of that phase. But then when you were looking at the phases where she was receiving the massage treatments, it was going down on average the whole time. And so this is why when you're looking at the charts, you see these lines going on these jagged up and down points, because essentially there is an up and down process of these things. And this is a condition that is something that is managed This isn't something that was necessarily going to be cured, and this is a very subtle thing that's not really being talked about in the massage literature very much, is this idea of what's being cured, what's being managed. And so as Ruth says, she got subtly better and better and better the first time she received the treatment. And then when the treatment was withdrawn, it started getting a little worse, going back up, and then right before she started receiving the treatments again, it spikes. And it continues to spike after she received the first session, but then it has one of the most dramatic drops that goes way down, and then it keeps consistently staying down or staying on a downward trend. And then, sure enough, as soon as it's withdrawn again, those levels start going back up. And so it really gives a nice foundational evidence for this idea that massage therapy could possibly be really beneficial for this maintenance of a condition. And when you do start withdrawing it, those pieces can get up. And even if you're not seeing improvement every time you're receiving massage, you're keeping somebody stable. You're keeping somebody within a nicer range, if you will. So,
well,
yeah.
And I'll pick up on that. I'm sorry, Michael, we're not giving you any chance to talk at all today.
Oh, I'm good. I'm just listening. This is great.
But, the next place to take that then, if I were a researcher, would be to see what receiving massage on a prolonged sort of management level basis did to the consumption of medication.
Mm-hmm. Yes, yeah, that could definitely be something. Were her medications changed? And taking that even further, okay, well now let's take a situation where we could follow some people who have Lyme disease they don't have massage therapy accessible to them, measure them the same way, and now you have a population over here that massage is accessible to them. They're able to receive massage. Boy, if you can get that funded, that'd be great, because ultimately, how do you pay for all this massage therapy, right?
With the money you save from the complications of the medications.
Potentially, yes.
Yeah.
But that, all those pieces aside, that would be a really nice design, and I think that this would be something to point to. Okay, massage seems to be effective here. There probably need to be a little bit of a pilot study first to gather some evidence between some groups that get massage, some groups that don't, and do this maintenance piece. And then you've got the layer on top of that you could look at the economic ramifications. Were medications changed? Were there I'm not sure what the stats are on this, but are there a lot of days worked because somebody has Lyme disease? Do they miss a lot of work? Or are they missing a lot of these sorts of things? And if they're receiving massage, is their absenteeism better or something like that? I don't know, but there very well may be some kind of economic way that you can track the benefits of massage in that regard. That would be
right.
Well, Nikki, it does say that further research with this population is warranted. So I think
I would say so.
We have all kinds of ideas about that. Yeah. But what Nikki was just talking about in brief was what we call cost effectiveness research, and that's it's a gaping hole in a lot of CAM therapies.
Yes.
We have some decent answers on is it effective in a lot of cases, but what we need to find out is it as effective as other things, and how do the costs compare? Mm-hmm. So we're working on
comparative effectiveness research, absolutely. Yep. I think the only other thing that we really haven't touched on in this particular report is one of the things that they do qualitatively. So they were just asking questions and pieces. Is this particular participant really liked the scalp massage? And that was something that she was asking for a lot, and really wanted to make sure that was part of her session. So even though it wasn't directly applied around or near her joints or where she was experiencing the pain, she found it to be exceptionally relaxing, which helped her then sleep better. And she was noticing that piece. That wasn't something that they measured, but qualitatively she was able to give that to them. And so just another piece, too, of something that's now documented, the relaxation that can be experienced by receivers of massage with that scalp massage. So that has a lot of other pieces that you can apply in practice.
That's delightful. That's actually, yeah. I just have, yum. That's my favorite part.
So yeah, I think that
Scalps and ears.
absolutely. So this particular case study, case report, paper, project, what have you, has really nice implications for practice, has really nice implications for research, and has really great applicability and opportunity in education to be able to bring this to students who may find this in their practice, not just for Lyme disease, but then just for other kinds of other immunity pieces, and or just people who need some relaxation. So yeah, really nice article overall.
Well, I also like the way it ended with, it actually gave, I don't see this too often, maybe I just need to read more, but it says massage therapists should consider using light to medium pressure for massage therapy for treatment of persons who present with a similar pattern of Lyme disease symptoms. So it basically kind of leaves the reader with a recommendation of how to apply it in their practice, which I really like. I mean, a lot of times it's kind of implied or we kind of just figure it out, but it actually kind of leaves us with a very specific next action, which I like. I don't see that too often.
It's a call to action.
It is a call to action.
And a take-home point. So it's
this guy in me really likes that, so I really appreciate that. So, well, I don't think I have anything else to add. This has been a great discussion. I originally thought it would be much simpler, but we've actually unpacked quite a bit here. So I do agree. Further research is warranted, so hopefully that will happen. So.
Yeah, I think big kudos to Megan Thompson and Dr. Moyer for the really nicely done study and reporting of that study.
Indeed.
But I do want to, I do, before we leave this off, Michael, I do want to really emphasize that that this therapist had access to some resources that most therapists do not. And I don't want for other massage therapists who have really interesting cases to be discouraged or dissuaded from writing up case reports because they don't have access to the same kind of resources.
Absolutely.
Yeah, I mean, we've discussed a few case reports here, the cleft lip one and some others that were, much simpler, much less statistically sophisticated, but still had great practice implications. And so please, while you get the benefit out of this really interesting paper, but don't let that stop you from thinking about doing your own case report.
Sure,
Absolutely.
we do want to encourage massage therapists to do case reports, and obviously there is a specific structure to it. There's some guidelines to follow, but inherently a case report is making an observation in practice, right?
Yes.
Right.
Okay.
And very soon we'll be, I'm sure, doing a research perch about some new criteria.
All right,
Yeah,
so stay tuned.
that will be coming up.
Great case
All right.
report.
Well, thank you both. Awesome discussion, and thanks everyone for joining us today. We really appreciate it. As a reminder, the journal is at ijtmb.org. Please go subscribe. It is free, and you can read about this paper and much more on that website. So if you are watching, thank you so much. You can click below if you want to take this with you on your mobile device. You can subscribe via iTunes or Stitcher for Android. Or if you're listening, thank you. Keep on listening. We appreciate those who are taking research perch with them at the gym, in the car, doing laundry, whatever situation works best for you. So we appreciate that. So again, thank you, Ruth. Thank you, Nikki. And thanks to everyone for joining us today. We will see you next time.
See you later, Michael.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.